The death toll from the earthquakes in Syria and Turkey has now reached 41,000 people. Rescue operations are continuing, with survivors still being uncovered 8 days after the disaster. A 77-year-old woman has been pulled from the rubble in the Turkish city of Adiman, while a 15-year-old Syrian girl was recovered in Hatay. The United Nations is now appealing for $400 million in aid for Syria, warning of the risk of disease. Well, let's talk to our correspondent Evangelo Tsipsas in Iskenderun in Turkey. Evangelo, attention now focusing on this huge rebuilding operation that now lies ahead.
Indeed. The plans to rebuild all these areas that have been destroyed, the buildings that have been destroyed and collapsed from the earthquakes, are now in the plans of the Turkish government. But before the Turkish government will be able to reach that point, they have to clean the debris to make more space for those medical teams to come in and support, because most of the rescue efforts of international aid have now conducted their rescue missions and have left the country, or will be leaving the country in the next few days, leaving the path open for medical support to come in. There's a lot of field hospitals, made-up hospitals across the region where it has been affected from the earthquakes. We're actually standing in front of one of those. We went inside and we spoke to some of the people who are running this one and other international medical facilities, and this is what they had to tell us. The public health system is on the brink of collapse. Medical resources have been stretched to the limit, but some international medical teams are providing relief here in Iskenderun. Across of a damaged hospital, the Indian Army has set up a field hospital, treating those injured in the earthquakes.
What we had were more of trauma patients who were buried in the rubble for many hours, and we conducted an amputation also, a life and limb saving surgeries. So the initial patients were more of surgical type trauma, which we have 2 orthopedic surgeons, 2 surgeons and critical care specialists. So we took care of them. Now the patient profile is changing. Now gradually the infectious disease kind of patients are coming, gastrointestinal infections, your respiratory infections, post-traumatic stress disorders.
This school is now serving as a hospital, scrambling to provide aid for those injured. It also serves as a primary trauma center in the Hatay region, as the government struggles to cope with a disaster of this scale, leaving thousands of injured people to rely on help from around the world. On the other side of the city, Roberto and his team have also set up a field hospital. Unlike the Indian Army, they also provide aid to primary patients, from medicine and psychological support to checkups and x-rays.
Like we provide a complete service for this kind of catastrophes. It's not only trauma. We have all these services around to support both the people affected directly by this situation, and also to cover the needs that appear once the local health services are not available anymore.
Many of the rescue missions have now ended, and teams have already left, leaving the field to the medical teams. With thousands injured and over 1 million left homeless, those living in tents and make-up shelters, there is a risk of a widespread outbreak of disease, making centers like this one vital in the days to come. Evangelo Tsipsas for CGTN in Iskenderun, Turkey.